Mr. Joseph Hamilton to address the Assembly. Thank you.
Thank you very much, Mr. Speaker. Mr. Speaker, let me begin by saying that yesterday on the opposition side they had 5 speakers. My assessment of yesterday would be that the best speaker on the opposition would be Dr. Ramaya, because he was the only one, the only speaker that offered a solution after he would have criticized. The best speaker. It is, this morning I had conversations with some PNC comrades, persons who support Mr. Greenidge in his quest for leadership of the People's National Congress. They indicated to me they were very much disappointed. One likened yesterday to a 50-over match, 2 teams playing. On this side, 306 runs in 50 overs, opening batsman AK Singh 155 not out. Expectation is at the stadium, because to open the batting for the opposite side is a Greenidge, CB Greenidge, a cousin of Gordon, I'm told. And so there is expectation on the other side, because a Greenidge is coming to open the batting. What we had yesterday, according to Mr. Greenidge's comrade, is that Mr. Greenidge spent 50 minutes in the wicket. Mr. Greenidge, honorable member, batted 50 balls, and Mr. Greenidge made 7 singles. The second comrade indicated to me that his experience yesterday of the comrade that he thought should have been the leader of the People's National Congress reform was that he was expecting his financial wizard to pounce on the budget, to dissect the budget presented by Dr. Ashney Singh. But instead what he had is, instead of his comrade presenting his case, the case to the Guyanese people that if I become finance minister, this is what I will do. Mr. Greenidge failed miserably. And that is the reason why I said that the best speaker on the opposition side yesterday was Dr. Ramaya. Because after his critique, he offered some solutions as to if he ever will become a minister, and if ever Mr. Ramjatan become the president, this is what we will do. Mr. Speaker, Mr. Bulkan, honorable member, we come again to the budget debate. The budget presented by the finance minister speaks to great ideals, a vision, hydro project, 4-lane highways, linking Guyana, Brazil, and Suriname, road networks, rail networks. And Mr. Bulkan, his presentation, I suspect, Comrade Speaker, is more suited for a regional council statutory meeting, not for the National Assembly. Mr. Speaker, second point is, Mr. Bulkan is yet to understand anything at all about anything at all about the local government system. When a member could liken the Regional Democratic Council with a national democratic, with a neighborhood democratic council, that informs you that he knows nothing about the local government system. Nothing at all about the local government system. Mr. Speaker, I will get to the exit in a minute. Mr. Speaker, I wouldn't even speak to my good friend, Honorable Member Keith Scott. Dr. Prasad, in the most elegant manner last night, dismissed and indicated with just one line, what is wrong with you? Mr. Speaker, my dear friend, Comrade Walter Lawrence, very proficient, speak to many of the issues that are important issues. My concern always is that when we're discussing social issues and delinquency of children, it is always the government. The question I always ask, where are the parents that brought these children into this world? That is the starting point. I said that in this National Assembly, and divorced from this conversation is always the parents. It is the Minister of Education, the Minister of Social Service, the Minister of Home Affairs. These are the persons that are responsible for children, and no one asks the question, where are the fathers and mothers that brought these children into this world? And Ms. Lawrence, you spoke to the issue of no features on the $5,000 bill for the blind. The $5,000 bill, on the right-hand side by the map, there is a feature for the blind. So, Mr. Speaker, last year when I spoke, my good friend Joe Armand needed for me to speak on the health issue. Last year when I spoke, I indicated to the National Assembly, Mr. Speaker, that the Ministry of Health will be launching the National Health Strategy, Vision 2020, that will run from 2013 to year 2020. That strategy was launched last year. There are three pillars that the strategy is built on, Mr. Speaker, is health across life course, non-communicable diseases, including chronic diseases, mental health and injuries, accidents and violence, communicable diseases, including traditional and emerging infections, environmental health, fifthly, food security and nutrition, health information and literacy. Mr. Speaker, many times when I hear the comrades on the other side speak about healthcare delivery in the country, I wonder sometimes where were they living? Mr. Speaker, the fact is, at no time in the history of this nation was so many Guyanese able to access health care. At no time. And that's a fact. Whether up the mountains, whether down the creeks and the rivers, whether on the coastline, every Guyanese today can access health care. Every Guyanese. Never in history. Whether under the colonial government, whether under the PNC government, it is the first time that through the length and breadth of Guyana, whether coastline or hinterland, every citizen can access health care. Mr. Speaker, never in the history of this country you had a doctor assigned to most of the health centers or a visitation of a doctor to health centers. Mr. Speaker, Mr. Lawrence spoke to the issue of elderly care and health care delivery. Mr. Speaker, presently, the Ministry of Health monthly have interventions at actually all the elderly homes in this. The Dharamshala, first time in the history of this country, where the Blind Institute receive medical intervention once a month, the Dharamshala, the Uncle Eddie's home, the juvenile center at the Hatfield Street drop-in center, the veterans home, Mr. Armand, the veterans home, once a month. Every month. Mr. Speaker, the Joshua home. So, some of the issues Ms. Lawrence spoke to, they have already begun. Mr. Speaker, again, many of us who are old enough would have known that in times past we had what we call home-based care, where the doctor visits your home. You put up the white flag, and they know a sick person was there when they came. Mr. Speaker, presently, home-based care is delivered in actually all the regions of this country, pioneered by Region 6 under Dr. Vishwanath. Mr. Speaker, these are some of the measures that we are doing at the Ministry of Health, and these are the healthcare interventions. I know when my good friend, Honorable Member George Norton, gets up to speak, he would speak specifically. He would speak specifically about his little problems he's having at the Georgetown Public Hospital. I always would say to Comrade Norton is that the Georgetown Hospital is only one place in the health sector. The Georgetown Hospital is only one place in the health sector. Mr. Speaker, the interventions that, Mr. Speaker, the interventions that we are doing, recognizing the backdrop, is the Minister of Finance last year made available 17, Ms. Ali, I would say this, you must understand that Rabbi Washington was because the PNC is. Mr. Speaker, and one of these days you'll get the full story. One of these days you'll get the full story. One of these days. Hopefully before Mr. Hamilton Green and Mr. Robert Corbett dies. Mr. Speaker, the sector expanded in excess of $17.7 million in 2013, recognizing the backdrop. Yes, Mr. Ramjatan. Yes, Mr. Ramjatan. Mr. Speaker, recognizing that many of the projects and programs that the ministry have implemented over the last 5 years, the donor support for many of those programs, some have come to an end, and some are not at the percentage where it was. The Minister of Finance, recognizing the new dynamic in the health sector, is now making available to the health sector $21.5 billion in the 24 budget allocation. And we thank him most wholeheartedly for that. Mr. Speaker, as I indicated, that one of the pillars of the new strategy is health across the life course. And Ms. Lawrence spoke to the issue of elderly support and elderly care. the Ministry of Health recognizing the need because of longevity of persons, and that, you know, Mr. Speaker, on one hand, you criticize the healthcare sector for not delivering healthcare services. And here the contradiction. You yourself is saying that persons are living longer. Why do you think persons are living longer? Because the healthcare intervention is there that was not there. They're just living longer. It is because 20 years ago, there was not the type of healthcare intervention that you have today. That is why people are living longer. It's simple. That is why people's life expectancy has moved from 56 years to 72, as you have indicated. It is because of the healthcare intervention. That is what it is. They didn't just start to live longer. Mr. Speaker, recognizing, I have already answered that question. recognizing, Mr. Speaker, that people are living longer, the Ministry of Health, we are attempting to put in place interventions. And therefore, under the auspices of the Regional Health Services of the Ministry of Health, with help from PAO, we conducted training sessions where we are moving and we are training doctors and nurses and healthcare providers in the geriatric care, recognizing, Mrs. Lawrence, that the health sector is doing better and people are living longer. Now we have to pay attention to care for the elderly health care. And that's why we have introduced home-based care. That's why we have introduced intervention at the elderly homes. That's why we have introduced these measures. Mr. Speaker,
you have 5 minutes with which to conclude, Mr. Hamilton.
Mr. Speaker, the other issue during the year were achievements. We did medical, surgical outreaches, Mr. Speaker, where doctors are assembled, you screen patients, and we go and do, last year, Mr. Speaker, surgical outreaches were done in Mabaruma, 3 surgical outreaches, 184 patients were seen, and 68 surgeries were done. Mr. Speaker, Bartica, 4 surgical outreaches were done, 132 patients seen, 88 surgeries were done. Mr. Speaker, they're from Suriname. Mr. Speaker, let them 2 surgical outreaches, 325 patients seen, 89 surgeries were done, 235 surgeries were done in the interland communities via surgical outreaches, Mr. Speaker. Mr. Speaker, let them Bartica North and the North Pacorimas, Mr. Speaker. Eye care outreaches, Honorable Dr. George Norton. Eye care outreaches were done, 687 patients seen, 492 patients were treated, and 56 patients were referred for specialist treatment. Mr. Speaker, ultrasound services were done, Lethem and Bartica, 434 patients were seen. North Pacorimas, dental services were done, 227 patients seen, 134 treatments. Mr. Speaker, the interventions by the Ministry of Health, and you would note, again, I make this, folks. I said in 2012 that for the several decades, when you spoke about a doctor of Amerindian ancestry, the only name come to your mind was Dr. George Norton. That is not so anymore. belongs to the People's Progressive Party Civic. In every interland community today, Mr. Speaker, you will find doctors of Amerindian ancestry who are trained, qualified, and who go back to serve their communities. Norton was there for 30 years. Mr. Speaker, we're glad you taught them, George. Mr. Speaker, Mr. Lawrence touched on the issue of cervical cancer. Again, recognizing the importance of cancers in female, the Ministry of Health, we have launched training programs, VIA training programs. 39 personnel currently providing, presently, Mr. Speaker, that we have 39 personnel currently providing VIA services at 19 centers sites across the region and in Guyana. GPHC, NTCT, Dorothy Bailey Healthcare, Bartica, Suddy, Skeldon, West Demerara, Lenora, Campbellville, Myconi, New Amsterdam, Lethem, Wisma, Kitty Health Center, and Mercy Hospital and Pokera Hospital. Mr. Speaker, as I have said, that the strategy allows for, and how we plan to ensure this strategy is successful is to mobilize and reorient our resources, to collaborate with communities, and we have started that already, improve health literacy, and to deal with intersectoral actions, recognizing, as the new buzzword now in the health sector is the social determinants of health. That healthcare is more than just getting sick. The issue of the environment and all of those issues. And so, Mr. Speaker, as I have said, Mr. Speaker, before I close, also we are seeking to review, update health legislation. Presently, the nurses and midwife legislation, that legislation was put together with collaboration with the Nursing Council and with the Nurses Association. Presently, that legislation is at the Attorney General Chambers to go to Cabinet and to come to Parliament. We have done consultation on the health protection and promotion legislation. That is repealing the public health ordinance. The optometrist legislation is also the Attorney General Chambers. Mr. Speaker, the mental health legislation, consultation is to begin. There's a draft mental health bill. Mr. Speaker, also the tobacco control legislation. Those two legislation consultations are to commence very shortly. So Mr. Speaker, as indicated when I started, that the Ministry of Health is appreciative, recognizing the new situation in healthcare delivery, recognizing that many of our donors will not be supporting many of the programs, and so to sustain these programs and to continue these interventions, Mr. Speaker, the Honorable Minister of Finance, he has indicated that he will make available more than $4 billion more than the government had set aside last year for the healthcare delivery. So, Mr. Speaker, I have outlined some of the programs that the Ministry of Health we have put in place for 2013. All of those programs would continue, and new programs also we would put in place so that our health strategy will become a major success. And